Thank you for coming. My name is Dr. Rani, and I'm with Ohio Northern University. We hope that the Behavioral Analysis Unit of the FBI will help to uncover the cause of the recent outbreak of anthrax among students on the Ohio Northern University campus. It appears that the entire Northern Commons complex has been exposed to a Bacillus anthracis outbreak. Various emotional support animals are registered on campus and may be the cause of the infection. We have gathered information about students living in and around Northern Commons that we think may help the BAU. We have also taken blood and biopsy samples of affected students and confirmed infection with Bacillus anthracis. We have brought in some of these infected patients in hopes that a cognitive interview may help determine the source of the pathogenic bacteria.
Infection occurs when spores enter the body. One type of infection is cutaneous, when the spores enter through an open wound or cut, as shown here. Bacillus anthracis first displays pathogenesis by finding entry into the host. One way to enter is cutaneously, as we saw before. Spores can also be aerosolized and transmitted through the air or ingested from contaminated animal products. Once inside, the spore germinates into a vegetative cell and can release a toxin throughout the body and bloodstream. The nature of the spores allows them to combat the body's immune system. When engulfed by host cells, the spores can lyse the immune cells and quickly continue spreading the infection. An anthrax infection results in tissue and skin damage. Specifically, cell lysis leads to necrotic tissue, including distinguishing black eschars on the skin surface in cutaneous forms. In pulmonary forms, low-grade fevers are common, and in gastrointestinal forms, lesions, pain, and even sepsis can occur. Here, you can see the patient exhibiting shortness of breath, itchiness of the skin, and a lesion of the skin, with a black center and red outer surrounding the black eschar. Finally, the anthrax infection causes lysis and death of the infected cell. The newly lysed bacteria can then spread throughout the body using blood for reproduction.
Hi, so I'm Detective Alatas, and we see that you are a victim of this outbreak, and we would like to ask you a couple questions. So if you just lay down and close your eyes, because we need you to remember a couple of things. So did you do anything out of the ordinary the past 5 or 7 days?
Went to class.
Have you come and contact any animals?
Oh, yeah, there's this girl in Northern Commons who has a pig.
A pig? Okay. Did you just play with her or with it?
I scratched her a little bit.
Okay.
I think she might have rubbed up against my leg too.
Okay. Do you have anything to add? Do you remember anything?
Beyond that, not really.
Okay. Thank you, and I hope you get better.
Diagnosis of an anthrax infection can be confirmed in a couple of ways. Some of the ways utilized are blood samples, skin lesion testing, respiratory secretion testing, spinal testing, and stool samples.
I'm glad to see you back. It has been 10 days since you started on ciprofloxacin. How's your lesion doing? It's almost gone. You're going to have a little bit of permanent scarring, but because you've been on the antibiotic for 10 days, I'm going to give you your very last dose, and then you should be good to go.
Perfect, thank you.
For treatment, children over 67 pounds or adults over 18 take 2 250 milligram tablets by mouth every 12 hours of ciprofloxacin. For children under 67 pounds, weight-based dosing of ciprofloxacin suspension is necessary. Ciprofloxacin is effective against anthrax as it inhibits DNA gyrase, type 2 topoisomerase, and topoisomerase 4, which are all necessary in cell division. This infection could have been prevented by the anthrax vaccine. The anthrax vaccine is typically used for adults between ages 18 to 65 who might be at risk of coming into contact with certain animals or animal products. Anthrax infections can also be prevented by avoiding contaminated animals and soils, especially in areas of open wounds.